Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, bile duct anastmosis in the or actually we'll see the five sequential anastmosis which are done for orthotopic liver transplantation. In orthotopic liver transplantation, we have to do the following anastmosis. First, suprahepatic inferior vena cava is anastomosed, then infrahepatic inferior vena cava is anastomosed, followed by portal vein, then hepatic artery, then finally bile duct is anastomosed. So first suprahepatic inferior vena cava, then infrahepatic inferior vena cava, then portal vein, hepatic artery and bile duct are five sequential anastomoses of orthotopic liver transplantation. And in the bile duct anastomosis, we can do either a choledochostomy can be done, or we can do for bile duct anastomosis, we can do either choledochostomy is done or choledochojejunostomy is done. In choledochostomy, we do an anastomosis between the bile duct, one bile duct with the other bile duct, that is donor's bile duct with the recipient bile duct. If both are anastomosed, then it is choledochostomy. Second, choledochojejunostomy. In choledochojejunostomy, if the donor bile duct is anastomosed with the recipient's jejunum, then by a Roux and Y configuration, then it is choledochojejunostomy.
thank you and thank you for watching.